Okay, so we're going to do a fun little Friday AI experiment. So what I have here is a single medical case study about a man who's come in because of cocaine-induced chest pain. Took too much cocaine last night. His chest started hurting, so now he's in to see the doctor. But what we've done is we've given this person, this character, 3 different personas through a little bit of prompting. And we're going to look at how much we can change this experience, this kind of role-playing experience, just by changing the persona of the AI. And I haven't done this, so this is the first time that I'm actually going through this conversation with Gilbert is his name. So our 3 characters, we have the AI default, which is basically no instructions about how to act. We have kind of a nervous and embarrassed Gilbert, and we have a combative Gilbert who doesn't think he needs to be there. Okay, so before we get into the conversations, let's just show what's the same in the back end. So there's one case here. It comes from the Gilbert program in medical simulation at Harvard Medical School. And this is the case about the 27-year-old with chest pain and how they got it, what kind of physical symptoms they're showing, and down to clinical progression around if given some beta blockers, then their blood pressure increases, if benzo is given, etc. So we've just uploaded that case study here. So just uploaded it here and told the app, the AI, this is the guide for the simulation. And then this is just kind of some introductory text. And here's where we made a couple changes around the chatbot instructions. So speaking in colloquial language, the rest of the details are in the case document. That's basically all we tell it for the normal scenario. We don't give it any personality. We'll see personality later. And then some instructions around voice. So we picked one of the voices and said, you're a 27-year-old male with a masculine voice, and this one is friendly. So that's the one piece of personality we gave it. And then at the end, it's just, we picked one action to do. So what do you kind of administer to this patient? And I want to check whether or not that the user did determine that they've elicited the fact that this is cocaine-induced chest pain, and then explain, given the action of explain what happens next. And all this is the same. The only thing we're going to change between the 3 actors is the personality, the voice, and some of the instructions that we give to the chatbot. So let's talk to our AI default, and we know that AI defaults to very friendly and very helpful. Hey, Gilbert, tell me what's going on.
Well, I've been feeling really anxious and I've got this chest pain that just started a little while ago. It's kind of deep and right in the center, you know? I'm also sweating a lot and having trouble catching my breath. It all started when I was out at a dance club and I had a few drinks and then, well, I snorted some cocaine. I didn't really want to admit that part, but it's important, right? I just feel really off.
It is important, yeah. So thanks for giving me all the details right up front like that. That was great.
No problem. I just want to make sure you understand what's going on with me. I really don't like feeling this way. It's hard to focus on anything else when my chest hurts like this, and I'm feeling so anxious. What do you think is happening?
Okay, so clearly extremely helpful in that mode. We're going to prescribe some B blockers and see what happens. And so we did correctly identify that Gilbert's chest pain is cocaine-induced. However, beta blockers are not the right thing to do, and so he actually got a worse heart rate and blood pressure, so that was a mistake on our part. All right, now let's talk to nervous and embarrassed Gilbert. Hey, Gilbert, tell me what's going on.
Hey there. So, I'm really worried. I came in because I've been having this, really bad chest pain. It started last night at this dance club where I was hanging out with friends. I was drinking a lot, and then, the pain just kind of hit me out of nowhere. I'm also feeling super sweaty and anxious, I can't catch my breath. It's really freaking me out.
Do you have any history of asthma, Gilbert, or heart disease?
No, I don't have any history of asthma or heart disease. I'm usually pretty healthy. The only thing I can think of is that I've had some seizures before, but that was related to cocaine use. I also had a car accident a while back because of drinking, but other than that, nothing serious.
And besides alcohol, did you take any other drugs last night?
Well, I might have snorted some cocaine. I didn't really want to admit it, but the chest pain started soon after that. I know it's not great, and I'm kinda embarrassed about it. but I just really wanted to have a good time.
No problem, Gilbert. I'm glad that you told me.
Thanks for understanding. I just really want to know what's going on and why I'm feeling this way. I just hope it's nothing serious. I'm really scared right now.
All right, let's give this Gilbert some benzo and submit. Okay, so heart rate went down, blood pressure went down. This was more along the right track of what we should be doing. All right, before we get into combative, Gilbert, let's take a look at what we've done actually on the back end here. So for this Gilbert, here's what we told him. We said, you've been brought in by an ambulance against your will and you're combative towards the doctor. You don't think you need to be here and you don't want to mention any drug use because you think it'll get you in trouble. You only admit if asked directly. Otherwise, you're going to lie and make up other reasons for your chest pain. As far as the voice, we just told this one to have an aggressive and combative masculine voice, showing some disdain for the person that we're speaking to. The rest is all the same. So let's talk to combative Gilbert. Hey, Gilbert, tell me what's going on.
I don't know, man. I just, have this chest pain and it started kind of suddenly. I don't think it's a big deal, though. I mean, I feel fine, just a little uncomfortable. You know? I don't want to be here, though. I was fine before all this.
How long has the chest pain been going on for you?
It kind of started maybe an hour ago. I was just hanging out and then it hit me. It's not super intense or anything, just more like a weird pressure, you know? But I really don't think it's a big deal.
Were you exercising or doing any kind of strenuous activity an hour ago, or did it really just kind of come out of nowhere?
Nah, I wasn't really doing anything crazy. I was just chilling with some friends, you know? We were just hanging out and then all of a sudden this chest pain started. It wasn't like I was running or lifting weights or anything. Just a normal day, you know?
Okay. I mean, do you have any history of asthma or heart disease or anything else that I should know about?
Not really. I mean, I've never had asthma or heart problems or anything like that before. My family's mostly been fine too, you know? No big issues, just the usual stuff. I feel like this is just a one-time thing or something. I don't know, man. I just want to go home.
All right, Gilbert. Well, I'll send you back and just take a couple ibuprofen and see if it gets better.
Wait, what? Just ibuprofen? I mean, I guess if that helps, but I really don't think it's anything serious, you know? I just want to get out of here. Can't we just skip all this and I'll be fine? I don't want to stick around.
All right, so let's end the conversation there. We'll say nothing, tell him to go home and take some ibuprofen and submit that. And we never specifically asked about his drug use, so we didn't get to the bottom of that. And if left untreated, we may see the heart rate increase or the blood pressure remain elevated. If we do send Gilbert home, then we wouldn't see these things. It does look like the AI is giving us general advice about what could happen with cocaine, and we should probably prompt it further next time and say, indeed, this is the cause of the issue, just maybe Gilbert hasn't told us. So the lesson here is even with the same core case study, AI can make fairly different scenarios, and it's up to us of how we want to set this up. Maybe one is for kind of more intro students and one is for more advanced students. Maybe we just want to give students in general more practice with the types of patients and the types of scenarios they may run up against. But all this is done basically just by telling an AI to behave a little bit differently, and we get quite different results.